right, so now we're gonna add that stretching component. We've got covered a lot, control the back pain, we've got mobility going. So we're getting into stretching. So we're really gonna focus on the spine itself. So we want, remember, if you can picture every vertebrae that you have, they all wanna move, they all wanna have this space so that pressure off the nerves, all those tight muscles, the pressure's off, okay? So the first thing I want you to do, now we're gonna kind of modify this a little bit. So we're gonna go from simple to hard. So the first category I'm gonna put is knee to chest. So I'm gonna go ahead and just hug one leg at a time. So, pretty basic, depending on what level you are as far as pain, okay? Go ahead and hug. I'm holding that for about 5 seconds, maybe 10. Like I said, my breath is more important than the count, okay? So 3 easy breaths I'm gonna say. So let's advance this a little bit. Let's just say that was actually pretty good, pretty easy, but you're not feeling a stretch. So go ahead, tighten your stomach, and then bring both legs to your stomach. Good. So inhale, there you go. So now remember, we want to turn off those muscles, allowing the spine to really open. Now when you take breaks over here, I don't want you to let go, right? I just want you to just give it some slack, so there's pressure off the spine, and you're right back. And if you're not really feeling much, it's okay. Your spine is getting stretched. It's got nowhere else to go but to open. But I would challenge you to make sure that you're kind of detaching, really relaxing. The second part of this movement is you're aiming to maybe get your knee to your chin. We're gonna try that. Okay, so again, these are kind of just a progression of knee to chest, but that's the most important part. The second part is go ahead and drop your legs into the table again. So, and go ahead and keep them bent. So again, keeping the theme of opening and closing your spine, we're gonna do what's called windshield wipers or openers. So go ahead and rock side to side. And remember, if you're in a lot of pain, you just might have a small window. But as you move, as you do these repeated motions, you get more motion. You actually feel better. Maybe you're touching pain, but you're saying, oh, that's okay. Okay? As long as we're not pushing past pain or causing more pain, you want to go to the point where it's caught. So as you can see, as Karina's moving, her tush, her pelvis is getting off the table a little bit. So let's advance her a little bit. So now, keep on rocking side to side. Good. And now you're going to drop one leg, and let's get this leg all the way over. And take your right arm right above the knee. Good. Just give it a good pull. Okay, so now we're just adding rotation a little bit higher to the chain. All right? So we're progressing from windshield wipers. That didn't really help much as far as feeling more mobile. So we're gonna push it a little bit. So now you're gonna feel this stretch in multiple places, depending on where you're tight. It's all right. Maybe you feel your tush, your side, your back. Okay, go ahead and go to the other side. Perfect. So we want to see that you are pretty aligned up, right on the table. You're not really moving through your bed, etc. Okay? So 3 easy breaths. I'd say do that about 5 times, but do to what you're comfortable. You know, more is okay too. Great. So now we've got that. So now let's go ahead and go on your stomach. Let's go on your hands and knees. What we're going to do is the prayer stretch. Okay? So the prayer stretch is going to cover multiple things. So go ahead and drop your tush all the way down to your ankle. You go to where it goes. Once you're here, now I want you to take your fingers and just crawl forward about 2. Yep, good. So now you really want to feel your back opening. You're going to feel this in many, many positions. Maybe you feel in the shoulder. Remember, this is dense tissue. You're not going to feel much along the spine. Your goal, shut it all off. Inhale through your nose. Exhale through your mouth. Okay, so now we're looking at a clock. So right now Karina is pointing at 12 o'clock. So Karina, let's put both hands 2 o'clock. Let's put all the right side. Great. So again, we're trying to open up the side, right? Opening up all this musculature. So we're doing everything here. And now let's just even it out. And let's go to 11 o'clock. Great, guys. I would do this for 10 seconds. I would do it 3 rounds each. Okay, again, you could do it more. I'd say 3. And the last thing I'm going to show you, you've seen it before, is the cat camel, okay? So we're going to end up right back here, neutral spine, okay? It's all from the pelvis, so we're going to go ahead and cue up, good, and then down. And I want you to do that a couple of times. And what you're going to see is that I'm going to exaggerate everything. So I want to see that head move, right? So inhale, that's it, spine down here, exhale. And let's go ahead and do it 3 more times. All right, guys, so that is the routine. Go ahead and try that out. Remember, you're not pushing through any pain, but if you're actually not feeling that you're not doing much, then go farther, go through the progressions and find what your comfort zone is.